Good morning, everybody.
The worldwide coronavirus deaths have crossed the 350,000 mark. The United States is the country with the highest number of deaths, followed by United Kingdom and Italy.
In Europe, the situation is variable in each country, but in general, the regions most affected are the big towns and the west of the continent. The United Kingdom, France, Italy, Spain, and Germany have the highest level of infected as a percentage with a citizen number, more than 1.5 million. The infection-death relation is about 10% on average.
In Germany, the confirmed cases were around 180,000 and the deaths were around 8,000. Germany is one of the first European countries that started to loosen measures, with the reopening of restaurants and the resumption of the football championship. Berlin has abolished the mandatory for those arriving from another European country. But, however, some outbreaks were confirmed on Monday, 18th May. In a meat factory, 92 employees tested positive, and the factory has been temporarily suspended. In Belgium, there was a protest against the Premier Sophie Wines, who visited some hospitals to meet those who fight on front line against the coronavirus. The hospital staff welcomed her and stood her at the entrance, turning her back on her. According to the Belgian radio, some nurses, doctors, cleaning staff, administrators and firefighters protested. School reopened on 18th May, but there were around 55,000 cases and 9,000 deaths.
In Africa, the coronavirus don't affect like other continents, but hospitals and doctors aren't enough. Africa has already huge problems with other diseases like AIDS or tuberculosis. Also, the data are not reliable. The contagion is not already unstoppable, but in a few weeks we could see a big worsening because a lot of people live together.
The condition in Africa suggests a possible massacre in the population that is young but already affected by endemic plagues such as tuberculosis and AIDS. If economic and health forecasts become reality, the continent could become the case of two serious events for Europe, become the place of rebound of the virus that would circulate among us. 2. Become the means of transport for transporting the virus worldwide. The European countries that need to stop or limit contact with Africa are the southern ones that would be effective in the front line. The first weapon to defeat the virus is social distancing, but 56% of the population is massed in slums and sheikhs. They are convinced that children are less sensitive to the virus, but 40% of them are undernourished and more exposed.
Tunisia did not any new coronavirus infection on May 18th. The 1,037 cases confirmed in the country remain stable. The allied continue to rise from 807 to 816. Tunisia has loosened its lockdown measures since 4th May with a first phase of gradual reopening in the vital sector of the economy. And Tunisia also provided important help to Italy during the month of April. 3 doctors and 4 nurses have in fact arrived at Malpensa airport to take up service at the Brescia Civil Hospital.
In Asia, the worst situation is past, but at least in countries like China, but the virus is not gone. In fact, a second wave has brought most of people in their home again. A problem is also the availability of data. Some regions like India or Japan are in difficult situation, but for example, the North Korea has weirdly 0 cases.
In China, concern returns to the city of Shulan. The city has 700,000 inhabitants and it is located northeastern of the city of Jilin. The alarming spread of the virus pushed the instant actions to impose a drastic lockdown similar to that imposed on February. Schools have been immediately closed and the transport system has been blocked. The city had been under observation since May 10 because it was considered an high-risk zone for the spread of the coronavirus. In India, in the last hour, there has been the highest increase recorded. The lockdown began on March 21st, has been confirmed until May 31, but there was a significant easing of restrictions. The government said that with an active citizen support, India may be able to defeat the virus, and the most important thing for them is preventing the spread of the virus in the places where it hasn't arrived yet.
In Nepal, a 29-year-old woman who had just given birth was the first person to die of coronavirus. In the country with a population of 28 million inhabitants, less than 100 tests were performed. According to experts, in fact, the lack of exams prevented the identification of other COVID victims.
In Israel, according to the updated date provided on May 18 by the Ministry of Health, there are about 300 deaths and positive cases are about 17,000. There are about 13,000 healings and commercial activities are gradually returning to normal, and in many schools, lessons resume at full capacity. Synagogues remain closed. On April 20, about 2,000 people went down to Rabin Square, 1 meter away from each other, to protect the agreements between Netanyahu and Gantz. They were spaced from each other, wearing masks to respecting the health rules against the spread of coronavirus. In Iran, there are about 123,000 cases of coronavirus. There are a total of 7,000 deaths registered, and the ICU patients are about 3,000, while the patients recovered are about 96,000. The Tehran government spokesman Ali Rabiei said that Iran is the third country in the world in the relationship between infection and healings. The number of Iranian cities believed to be low risk has reached 280.
In America, the coronavirus became a problem after other countries, especially in USA. When the lockdown started, the cases were just too many. On the contrary, Canada is the least affected if we count the relation from infected and territory. In Central America, there are lots of outbreaks.
In the United States, during the day of May 19th, there were actually 20,000 new cases, and the victims were around 1,000. There are now 1.52 million total infected, with 90,000 victims. The figure is expected to worsen within a month. Several studies have been carried out by Johns Hopkins University. These have led to the discovery that the dead and the infections could triple in no time. This is why experts are asking for more precautions. But Trump has decided to end the lockdown. In the Latin America, the situation is worsening, with an 500,000 infected, and the victim arrived at 30,000.
Brazil is at the top of the ranking with almost 45% of infected and well over half of the death, about 16,000. It is also in fourth place in the world, ranking by number of infected, surpassing Spain immediately after Peru. with about 90,000 cases of infection and about 2,000 deaths.
Thanks for the big distances from a village to another, in Oceania, only the biggest towns have more cases of infected. The precautions have been taken in time, so about 8,600 people are infected in all Oceania. The proportion from infection death is very low.
Australian Prime Minister Scott Morrison has announced that the government will allocate 130 billion Australian dollars in the next 6 months to deal with the coronavirus emergency. According to the reports from the BBC, the fund will be used for assistance to approximately 6 million Australians.